You see the headlines all the time, right? A new virus, a sudden outbreak. But have you ever stopped to wonder how we actually spot those things in the first place? Well, it's not magic, it's data. And I mean mountains of it. Today, we're diving into the simple but incredibly powerful language that lets public health experts find that one life-saving signal in an ocean of noise. So, before we get to the solution, you really have to grasp the scale of the problem. We're not talking about a little stream of data here. No, we are talking about an absolute, overwhelming flood. Every single day, the healthcare world generates zettabytes of information. And if you're thinking, what on earth is a zettabyte? It's a trillion gigabytes. Yeah, it's a number so big it's almost impossible to wrap your head around. And without the right tools, all that data, it's just static. And this data isn't showing up in nice, neat little packages. Oh no, it's pouring in from hospitals, labs, clinical trials, even from your fitness watch. It's messy, it's complicated, and it's all stored in a million different places that don't talk to each other. It's kind of like having the world's biggest library, but with no card catalog. That's the mess we're trying to sort out. So, how do you find the one book you desperately need in that massive, chaotic library? Well, you need a way to ask. You need a language that lets you tell the librarian, or in our case, the database, exactly what you're looking for. And that really is the central question, isn't it? How can we ask something super specific like, hey, show me every zip code that's had a spike in flu cases in the last 48 hours and get a clear answer back in seconds, not weeks? The answer is a language called SQL. You might have heard of it. It stands for Structured Query Language. A database is really just that digital library we've been talking about, a massive organized collection of information. And SQL? Well, SQL is the universal translator. It's what lets us humans talk directly to the database and tell it exactly what to find. But look, this isn't just some abstract theory for computer scientists. Not at all. SQL is being used every single day on the front lines of public health, helping people make decisions that directly save lives. Let's actually see what that looks like. So first up, disease surveillance. When a new threat pops up, speed is everything. Analysts need to know where it is, who it's hitting, and how fast it's spreading. And they need to know it right now. And this is where it gets really amazing. An epidemiologist can write a quick little command, it's called a query, to scan thousands or even millions of records for a weird pattern. In seconds, they can generate a chart just like this one, showing a clear, totally alarming spike in City B. That right there, that's the signal. That's what kicks off the investigation. It's an insight that takes moments to find, not days or weeks. But it's not just about reacting to emergencies. SQL is also absolutely critical for being proactive, for actually improving the health of an entire community before a crisis hits. This is a perfect example of what I mean. With SQL, a health system can search through millions of patient records to group everyone by their health risks. This simple visual can instantly show them, okay, this slice here represents people at high risk for diabetes, or this group is way overdue for preventive care. It lets them focus their time and money exactly where it's going to do the most good. And that same power, it goes straight into the world of medical discovery. Just think about the clinical trials for new medicines and vaccines. They create these huge, incredibly complex sets of data. At every single stage of a trial, researchers have to slice and dice that data. With SQL, they can ask super specific questions like, show me the average improvement for patients between 40 and 50 years old during phase 2. Getting those precise answers quickly is exactly how they figure out if a new drug is safe and if it actually works. What all of this really represents is a huge leap forward. I mean, the old way of doing this was manual, it was painfully slow, full of human error, and just couldn't see the big picture. With SQL, it's fast, it's accurate, and it even lets us do predictive analysis, helping us see not just what already happened, but what might happen next. So, at the end of the day, SQL acts as this absolutely essential bridge. It's what connects the messy, chaotic world of raw health data to the clear, actionable insights that drive all of modern medicine. And you can see exactly how that bridge works right here. You start with all that raw, messy data. You use an SQL query to ask a very focused question. That query instantly turns the chaos into an organized insight. And that insight, that leads directly to a smart, informed decision. It's really the backbone of public health data because it does these four things so well. It can store gigantic data sets. It lets you ask questions and get answers in a flash. It makes complex analysis possible, and this is the big one, it can pull together data from all those different disconnected sources we talked about at the beginning and make it all make sense. Our source material makes a really critical point for anyone who's interested in this field. You can't just read about this stuff in a book. The only way to really get it, to really understand it, is to get your hands dirty with the data and practice. That's how you learn to ask better questions and find the stories hidden in all those numbers. So, as we wrap this up, it's pretty clear that this is about way more than just a programming language. It's about unlocking the potential to understand our collective health in ways that would have sounded like pure science fiction just a generation ago. And that leaves us with one last thing to think about. If you had the power to ask any question of all the world's health data to find any hidden pattern, what's the very first question you would ask? All right, that's it for this breakdown. If you found this useful, definitely let us know down in the comments. We honestly read all of your feedback to figure out what we should tackle next. Thanks for joining us.